More than 100,000 COVID-19 cases were recorded in the UK in the last 24 hours. It is the first time the number of daily infections passed that milestone since mass testing began. The sharp rise is being driven by the rapid spread of the Omicron variant, with governments and their advisors waiting for data on the severity of the new strain. Today, a very small study in Scotland suggested that the risk of hospitalisation was two-thirds lower than with the Delta variant. Let's have a look now at the latest infection figures. And 106,122 new cases of COVID-19 were reported today. That's 140 more people have died as well, taking the number of people who have died within 28 days of a positive COVID test to 147,573. 968,665 new boosters or third jabs were given yesterday, with first and second doses taking it to a new record of more than 1 million vaccines done in a single day. It all means 30.84 million people have now had their third jab or booster. Sky's Sadia Chowdhury is in the newsroom, and we'll talk about child vaccines in a moment, Sadia. First of all, this data, and another milestone has been passed.
Yes, two records there, one good and one perhaps not so good. Let's start with the good. That's the vaccine rollout, that new record that you've just mentioned. And of course, it's not surprising. We've all seen the queues. I've been to some of these vaccine centres myself to report, and I've spoken to people, and there was this sense of urgency to try and get vaccinated before Christmas because people want to be safe for Christmas. They want to make sure that they're not infecting their family members when they see them. So there was this massive push. And I think that explains why we're seeing this new record, as you say, of over 1 million vaccines given out today, the vast majority of them boosters. But then there's a bad record too, and that is the over 100,000 new cases. And let me just mention here that there is a difference between cases and infections, of course. Cases are those people who have reported and have tested positive for COVID, but, you know, infections are people who may have been infected, may have been asymptomatic, so we don't know what that number is, but certainly it's a worrying number. And if we had thought that things were going to plateau, then we were wrong, because that number seems to be growing. Now, I'll just tell you last Wednesday's figure. The number of new cases last Wednesday was 78,610, and at that time that was the highest number of infections since the start of the pandemic. And at that time, NHS England's chief executive said that that number should worry us all. So now we're above 100,000. I wonder what he would say to that.
Right, and no mass vaccination of 5 to 11-year-olds, but vulnerable children of that age will get a jab.
Yes, so this new formulation of the Pfizer-BioNTech vaccine has been approved by the UK's Medicines and Healthcare Products Regulatory Agency, the MHRA, and that means that some children will be allowed to get the Pfizer vaccine. And as you say, the majority of children of that age group, between 5 and 11, are at very low risk of getting seriously ill from COVID. So it will only be those children who are in a very clinically sensitive group, or someone who lives with somebody else who is immunosuppressed. So a very small number of 5 to 11-year-olds will get that vaccine, and that's what the JCVI is saying. And I'll just read out to you what the JCVI's COVID lead, Professor Wei Shen Lim, said. The majority of children aged 5 to 11 are very low risk of serious illness due to COVID-19. However, some 5 to 11-year-olds have underlying health conditions that put them at higher risk, and we advise that these children be vaccinated in the first instance. And I can tell you that a primary course vaccination for that age group is 2 10 microgram doses, and that is a third of what we adults get.